Good day, friends of Buzzy. Well, this is a kind of exciting day because normally I will synthesize what the news is saying or what the articles are saying, but you can probably get my insights on what to do with COVID-19, with boosters, or with information elsewhere. Today is really exciting because there is some breaking news related to what is the right thing to do if you got one vaccine and you're offered another one. So do you take vaccine roulette? I guess it's more the Monty Hall dilemma, isn't it? Do you take the vaccine that's behind door number 3? And if that one goes away, then do you switch your choice? I don't know. I actually do know. So today we're going to discuss what the differences are between the vaccines and how many people have been vaccinated, what the questions are, what the current recommendations are, and then what to expect when the FDA issues its guidance on whether or not you should switch vaccines. And I will tell you that what I read surprised me, and it definitely told me what to do. Now, let's go to a brief overview of vaccines. First of all, I am Dr. Amy Baxter. I am a pediatric emergency doctor, but I have had the fortune my whole career to be in academics and to have time to research things. So I have a deep experience reading papers, reading grants, and looking at science that I may not have been trained in, but finding out what's really important about it pretty quickly and synthesizing it. So I like to say I'm a synthesist and I'm synthesizing what's out there for you guys with the boosters. Okay, so the difference between the booster or between the regular vaccines. So mRNA vaccines are the Moderna and the Pfizer, and adenovirus vaccines are the J&J and the AstraZeneca. Now, the adenovirus vaccines are the ones that take a thing that people catch, like adenovirus, and then take off the parts that make you sick and put in the information that will make your body able to make antibodies. So any vaccine is going to teach your B cells to make antibodies, and it's going to teach your C cells to teach other cells and to take out the bad guys directly. So you've got something making antibodies and something that can be sort of the library of how to make the stuff that kills the virus. So you got your B and your T cells, both are important. Now, the thing about mRNA viruses or vaccines is that they've been around for about 20, 25 years. They're new to humans, but they're very well established in animals. And what they do is they actually just take the information that the body needs to make and inject it in a way that the body can decode it and just make the antibodies it needs. So you're still going to get your T cells that are taught once they're exposed and the B cells, but it's just a more direct way of saying, here you go, here's how you make the antibodies. All right, now what we have found in this COVID opportunity is so much more about how these vaccines interact. Initially, people were worried that if you got one kind of vaccine and then got another one, that the antibodies to the first vaccine might wipe out the antibodies from the second one and completely eliminate their effect. That was tested in the UK when people were given AstraZeneca and afterwards were allowed to either get an mRNA vaccine or another AstraZeneca. Turned out, getting an mRNA vaccine was 2 to 8 times better. So that was our first touch of what do we do with mix and match? Is it a good thing or a bad thing? So there's a beautiful study that got published this week, a preprint from Robert Atmer et al. And several people from Emory, shout out to Emory Med School. But what they did was this gorgeous study looking at people who got either Johnson & Johnson or Moderna or Pfizer, and then they gave them all either Johnson & Johnson, Moderna, or Pfizer, Johnson & Johnson, Moderna, or Pfizer. So you had 9 different possibilities, 9 different permutations. So what is being reported right now in the literature and in the newspapers, people are talking about how much of a boost did you get with each thing. So let's talk about where we are as a baseline as in this country. So the number one vaccine that has been put in arms, anyone? You gonna guess? All right, Pfizer. Part of this is because 11 to 17-year-olds are allowed to get the Pfizer vaccine, but 104 million people have been vaccinated with Pfizer, and the second most is 69 million with Moderna, and the third most is 15 million with Johnson & Johnson. Now, Johnson & Johnson served a great purpose early on as a single-dose vaccine. It was an adenovirus vaccine, so if you were a nerd and you understood the difference, or if you were not a nerd and you were concerned because you didn't understand mRNA vaccines, J&J was a good choice. We had a really cool experience in Little 5 Points Pharmacy for people that were either skeptical or afraid of needles or worried about fainting or worried about the pain afterwards, and all we gave was Johnson & Johnson, and 10 out of 11 people who showed up, it was wanting to be one and done, didn't like needles, just get it over with, whatever. So we'll deal with that a little bit later. But the question you might have is, okay, so what happened? I got a Johnson & Johnson vaccine. Should I get a Pfizer? Should I get a Moderna? Does it matter so long as I'm getting an mRNA vaccine? Well, this is what's being reported in the news, that if you got the same vaccine as you got before, then the bump in your antibodies was between 4.2 times and 20 times as much. And if you got a mix and match vaccine, then the bump in antibodies was between 6.2 and 76 times more. Okay, so if you know that, what are you going to do? If you know that mix and match was only went up to 76 times better and the same one went up to 20 times better, what do you do? Thing is, what they don't report in the news, but they do if you look at the actual paper, is the raw numbers of antibodies. And the thing is, Moderna blows everything away across the board. Now, interestingly, they don't report the data from the people who got the Pfizer vaccine and what their total number of antibodies were 4 weeks later. It says pending, so that's kind of interesting. But if you look at all of the other parameters, yes, Moderna only goes up 20 times more if you get another Moderna, but that's because you were starting out at 8,000 antibodies instead of 2,000. So what this is to say is that don't just look at the multiple of how many antibodies it jacks you up. You really need to look at what the total number of antibodies are. And so I personally got Moderna. And when I first read the stuff in the paper, I was like, well, you know what? I'm going to go out there now and I'm going to get myself a Pfizer vaccine because I can. But the boosters are okayed for Pfizer for age 65 and up and for people that are in healthcare or at risk. And honestly, if you just go to most pharmacies, they're like, whatever, tell me you need it, tell me you're essential. If you want it, I'll give it to you. I wouldn't do that just yet. Depends on what they say at the FDA, but I believe that what they should say is that if you have not gotten an mRNA vaccine, you should get an mRNA vaccine. And if you've got a Moderna the first time, you should stick with Moderna. So looking at this, if you got a J&J, no question, it was fourfold higher when they got another J&J vaccine. When they got either of the mRNA vaccines, it was up to 76 times higher. So that was where that mix and match really high number came from. If you got a Pfizer, I mean, honestly, I would still get a Moderna no matter what, if you could. But the differences are probably not going to be that statistically significant. I mean, if you look at the hospitalization rates so far, what we know is that any vaccine at all, you're 18 times less likely to get hospitalized, you're 11 times less likely to die, and so any vaccine is good. But as these vaccines start wearing off, now you start looking at breakthrough infections. So with J&J, there was a 71% effective, so like 29% had breakthrough. With Pfizer, 88% effective, but with Moderna, it was 92% effective at keeping you out of the hospital. So 92%, 88%, I mean, that's not that big a difference, but still slight edge for Moderna. So to recap, let's think about what you would do. I think that the booster amount, whether you get a Pfizer or a Moderna booster, you're still going to give yourself probably, best guess, 18 months more immunity before you need another booster. So assuming that we do go forward and get boosters with the flu shots, whether you get Moderna or Pfizer probably doesn't matter. Now, if you are in a situation where you're at risk and you're in a situation where you're going to be traveling, where maybe you're like me and your last vaccine was in February, then probably I would go get whatever vaccine I can. I thought about doing that, but seeing the data in this paper, I think I'm going to wait for the FDA guidance to come out and for Moderna to be made available for anybody who needs it. One other thing that's happening is that the 65 and up data is probably going to be skewed down to age 40 and up. So most likely in the pipes, you won't even have to say, oh yeah, I'm an essential worker. If you're 40 and up, you can just probably go get a vaccine if you want it. So all of this stuff is always confusing. I think that the simple take home is, if you are traveling or at high risk, get whatever mRNA booster you can, and right now that's Pfizer. If you're not at spectacularly high risk, or you're not an essential worker, or you want to make sure you're honest in getting your booster, then I would wait a week or two, and pretty soon, within that time period, mix and match is going to be approved, guarantee it. And hopefully Moderna will also be approved for people who need it and down to 40. Right now, Pfizer is the only one that's approved for a booster. If you're traveling to Europe, they only let you in with your vaccine card if you've had a vaccine in the last 6 months. So if you got your vaccine finished, if you got your series finished before April and you're traveling in over Thanksgiving, you're going to need a booster because your vaccine card isn't going to do it if you're traveling to Europe. Any mRNA booster is a good one. And if you've got the luxury and access to Moderna, go for that. It is the right answer. But what you're probably going to see in the news is mix and match is fine. And probably they're going to say, ideally try to get an mRNA. Unless, I can't imagine why they would say, go ahead and get a J&J, because it's all still one shot now. So it's not like you're telling somebody to get 2 shots versus 1. But the needle fear thing does bring up a really important point, and that is that before we get to the issue of mandates, which are likely to come out end of October, beginning of November, we have an opportunity to vaccinate people who don't like needles, but don't want to be told what to do either. So as we get ready to go with the Pfizers and to be able to vaccinate kids down to age 5, which will do so much to keep us safe over the course of this winter as temperatures drop and it gets easier to spread COVID. As that happens, what we have done at Pink Care Labs is we have made a comfort immunization resources set of materials. So as of Monday, October 24th-ish, we're going to have available for companies to buy downloads that will help their staff get vaccinated if they're worried about fainting, if they're worried about arm soreness, or if they're worried about getting anxious and panicking on the chair. Now, some of these things are equivalent for kids. And so when it comes out that kids can get Pfizer vaccines, any company that is ensuring their workforce is going to want to make sure the kids get vaccinated. But it may also make it a little easier for the adults to download these resources without losing face. So we've got 5 magic tricks for needle sticks, which is the things to do to help work yourself better. Turns out you only need 3 good needle experiences to reduce the panic and the fear and the pain by half. So we've made super cool ways that you can tell people in your pharmacy or tell people if you're doing a vaccine drive that you understand, you get it, and this is not going to freak people out, and no one's going to make fun of you or roll your eyes. The next thing we have is we've got posters that you can put up that actually show people, which I took out of my binder, but which actually you can post that say, here's tips for fainting, here's tips for anxiety, here's tips for soreness, so people can just do it themselves and not have to engage with a healthcare worker at all. Having control of their situation makes it a lot better. So please stay tuned to our website, get on our mailing list, look and see what we have. We're going to have the training is still available for free on our downloads. That is training staff empathy. People have to understand why there's so much needle fear, because otherwise they're like, oh, it doesn't hurt. I think the analogy I'm going with right now is if you were a 4-year-old and your parent took you to the Grand Canyon and held you over the edge and said, you wouldn't want to fall, would you? And then pulled you back, wouldn't you be more likely to have a fear of heights than if that didn't happen to you? It's the same thing with needle fear. Your parent took you to the doctor, said, this is good for you. You got a bunch of needles and you weren't old enough to understand why. That can make you afraid of needles. Nobody who was born before 1985 had that as a scheduled routine part of their childhood. Everybody who was born after 1985 was supposed to have that happen, because that's what the CDC injection schedule is. So that's why young people or people who came from another country or had to get catch-up shots, they've got a different experience than those of us who are old and are largely in the decision-making process. So I can't grok needle fear, and people who are 50 or who didn't take their own kids can't get it either. So that's the kind of empathy training, just looking at those numbers to understand this is why you don't need to think this person is weak, and this is why you should treat them with a let's have compassion, help you get over this, so that when the next pandemic comes around, when the next set of vaccine boosters comes around, it's no big deal. All right. Please like, subscribe if you're seeing this on YouTube. If there are any questions, please send them to us in a week in advance. We do our Facebook Lives every other week. And guys, you know what? We're getting to the end of this. It's going to be fun.